All right, guys. Today I'm going to be speaking with Dr. Barghouti, Taleb Barghouti of Jordan, and we're going to be talking about some of the issues that are going on in the hair transplant industry at the moment. So I hope you guys will find this informative, and please ask questions. That's what we're here for. It's going to be a live interactive Q&A. Thanks, guys, for joining me. So pretty soon we'll be having Dr. Taleb Barghouti joining me. Just waiting for him to come on. So just give me a minute here, and he should be joining soon. How's it going, Ali? So we're going to be speaking with Dr. Taleb Barghouti of Jordan. Just waiting for him to go ahead and join the live session right now. So I'm going to give him a couple more minutes. Let's see if he joins us soon. How's it going, guys? Just waiting for Dr. Taleb Barghouti to go ahead and join us. There we go. Hey, Dr. Barghouti. So just go ahead and request. Hit the request. So I sent the request here. There we go. Hey, Dr. Barghouti.
Hi, how are you?
Pretty good. Nice to have you here.
Thank you, likewise.
So I wanted to ask you, Dr. Barghouti, sorry, phone's slipping here. I wanted to ask you, what's one of the biggest issues you see going on in the hair transplant industry right now?
Yes, so basically in the region where I'm practicing, can you hear me well? Actually,
Yeah.
just checking.
Yeah, I can hear you good.
So in our region mainly, as you know, there has been an increase in the number of surgeries being performed globally. So this has been reflected in recent census reports by the ISHRS. So the Middle East has been a very strong region in terms of increase in numbers of procedures done, and this has been contributed mainly by cost elements and also popularity of the procedure in our region and neighboring countries. This, on the other hand, created some issues and some troubles in that more and more clinics are tempted to offer such a service or such a procedure, and with time this has created more sort of lower or poorer quality work, or an attempt to commercialize the procedure itself. And in that sense, we, as you and your community would know, we've started seeing more complications that used to be less and less common, are now being seen, wide across on a daily sort of basis when patients follow up. So things like donor depletion, things like improper planning, procedures done at a younger age, as well as aesthetic issues such as directional errors and growth sort of unnatural results in general. So these things have been naturally happening as a result of the explosion in the numbers that we've noticed recently, and also the cost element which has dropped significantly.
So you mentioned something that really caught my attention is you're seeing a lot of issues going on with mostly young guys, right? The guys that you're seeing with these really horrible donors and everything are usually younger, in their 20s. And so they come to your clinic after they may have gone to a place that isn't really, they're not being seen by a doctor. Maybe it's all technicians. Maybe the technicians don't have that much experience. Maybe they're just going to that clinic purely because of cost, right? They're
Mm-hmm.
looking at
Yes.
cost first as instead of looking at the results. So when they come to your clinic, what are their options? What do you see? Um, do you see lost causes? Do you see, cases where you just can't unfortunately help them?
I mean, to be honest, it's a range of problems. So in some cases, let's say they were given bigger numbers or promised bigger number of grafts, but this has not been done. So luckily, there's still, donor hair left or beard hair left to, revise the procedure. So in some cases, maybe the luckier ones, the number given was not correct, and that means there's almost untouched donor in the back. And
Mm,
in such cases, you can actually do something. You can maybe revise the hairline if it's not properly done, remove big grafts, relocate them. You can offer something. In the other extreme is a completely depleted donor with a poor hairline design, maybe poor growth as well, poor directions or wrong directions. And in such cases, there's not much you can offer. So it tends to be things like micropigmentation or hair systems, maybe with, as you've seen in some of the posts we've published, just fixing the hairline and then applying a hair system if someone is keen on having a high density or full coverage.
mm.
So this it varies, and in some cases, some patients are luckier in their complications, and some are not. Unfortunately, it's not a good position to be in that sense. But again, if something can be done, or we can make things a bit less painful, we may proceed with some revision. In some cases, we can't.
Yeah, it's a shame, when I know right now the number one question that everybody asks me in DMs and everything is how much is a how much is a hair transplant going to cost me? And I get it. You know, most of us aren't millionaires. We need to be looking at cost as a factor, but when you're motivated simply by cost, you're going to find yourself in a lot of problems because the cheapest clinics aren't necessarily going to be the best clinics. So how I think you should do it, right, is to research a clinic for the results, reach out to them and see if their cost is going to be in your budget, and then go from there. Um, but you mentioned something that I've always wondered, and you said, sometimes you offer patients SMP and stuff like that. Have you ever seen or uh, provided SMP in terms of filler, like just to kind of do like a hair
A
loss
topic
concealer, like a
effect.
topic? Yeah, you
Yes.
give them a hair transplant and then SMP just to make it look a little bit fuller.
Yes, absolutely. And again, it depends on it varies from one patient to the other. So you need to pick the right candidates for it. First of all, if it's something that is more of a diffuse thinning, you may need to be on very strict maintenance because the last thing you want is to be forced to have the shaved look when on all the hair falls, or for the micropigment dots to show with as the hair loss progresses. So it's very important to be on very good maintenance for in such cases. Of course, they should be aware of the fact that this may happen, that hair loss may progress, and then they may need touch-ups and further SMP to handle that. And at the same time, what you need to know is that you know SMP is something that needs continuous touch-ups.
Mm,
So the color will fade. It may need a touch-up in few years, depending on the ink and the pigment. But it's very important that you select the right patient for the filler effect, because they need to be sure that this visual effect needs to last, and it needs to be helped by your existing hair being there.
Yeah. Yeah, it's sort of like you have to have a certain amount of hair for the SMP to look good. Just like with hair
Yeah,
fibers or any derm match or anything like that, you need to have
exactly.
hair to be able to cover so that it,
Hmm.
it gives you a good appearance of fullness. Um,
Correct.
so yeah, that's all good information. You mentioned diffuse hair loss, and I wanted to know because a lot of people always send me questions like, what are the complications transplanting on someone with diffuse hair loss? Can it be successful? How should you approach it? How should someone with, let's say, they're a diffuse Norwood 6, but they still have a lot of miniaturization, but they still have a lot of hair, how should they approach getting a hair transplant?
Again, it all starts with proper consultation. I think it's very, very important to meet everyone, or to actually have enough time talking to the person looking for a service. So um, it's very important that you highlight things like age, family history, progression to more advanced balding stages, maintenance or very strict maintenance regimen. And also, these are things that you may not be able to fully control surgically or technically. So it's
Mm,
very important to highlight these in terms of what might happen or what might progress in the future. But at the same time, you have to look at things technically, such as shock loss
mm,
to native hair during surgery. So you might need to be very cautious with transplanting between existing hairs to prevent any shock loss
mm.
in the existing hair. Luckily, it is temporary. But I think the main thing is to assess the patient in terms of donor area, the likelihood of advancing into a more advanced pattern, age, and as I said, the donor area, and also be very technically aware of the procedure. Nonetheless, I think you get really nice results with diffuse hair if you select the right person for it. Probably I should actually publish one or two cases of diffuse loss, maybe in the next posts. But you do get in the right patient nice results.
Nice result. So if you, with the proper planning, with performing the surgery carefully, you can minimize, shock loss, and someone with diffuse hair loss can actually get a good result,
Yes, yes,
which I think
absolutely.
is important because a lot of the times people say, diffuse hair loss, forget it. You're gonna lose all your hair and you're just gonna look the same. So with proper planning, carefully doing it, not trying to go to like a clinic that's gonna do 5,000 grafts and just completely deplete your donor, but doing it right, you
Yes,
can get a good
absolutely,
result. We got a
absolutely.
question here from Wavy Sneakers. He says, does head size make a difference? Would someone with a small head be a good candidate? There would be less area that would need to be covered.
Yes, I mean, absolutely. It's all about, everyone asks about density per square centimeter, and I know it's not everything is about density. You have to look at caliber, direction, sort of the hair characteristics itself. But again, you can't deny size. So if someone has his frontal zone or generally bigger head, then the frontal zone would have a slightly bigger density or slightly bigger surface area to cover.
Mhm. Yeah.
And that means you need more graft. So you might have a big head, but you might as well have a bigger donor area. So
That's what I was going to ask you. So if
it
you have a
it
big
it
head,
really
might mean that you have more donor area. So,
exactly, and that means it could be the same effect in the end. So again, you have to assess each person. But yes, generally, bigger head, you would need bigger coverage or more grafts to cover that area.
We got a question here. Can you transplant hair from another person? I mean, I think that's pretty straightforward. No.
Absolutely not. No, unless I think identical twins, it was done, but again, the balding pattern will be the same. So,
Yeah.
um,
We have another. How important is finasteride in post-transplant maintenance? Worried about side effects.
uh, to be honest, for me, I almost ask everyone to be on finasteride. Um, it's just evidence-based. I'm inclined now to use alternate day dosage, which I think gives good outcomes, reduces the side effect likelihood, but
Mm.
at the same time, I push everyone towards finasteride. And I think if someone is not on it on the day of surgery, we ask them to start it the second day. Unlike minoxidil, of course, but we start finasteride immediately after, if not before surgery.
What's the incidence and side effects that you see in your patients, like percentage-wise?
We follow up quite well, actually, everyone. And I think, to be honest, maybe 0.5%. I
How
would
many?
say 0.5%.
0.5%. Wow,
Yes.
that's a low. That's a low number.
In terms of, let's say, sexual side effects.
Okay.
So some people get, they feel the sort of fatigue, some sort of maybe loss of, energy in the first month. But I've seen it less and less with the alternate day dosage. So um, I'm quite happy with the current dosage, actually.
Mm.
And I'm even happy with 2 a week. If someone, anything that would actually maybe
Reduce
put
the.
them at ease, in trying it at first, because you often find patients who start with such dosage and then on follow-up, if they want even more progress or more result, they say, well, we're happy to up it up by 1 day extra or 4 days a week. And if they're happy with that, then that's fine, because we know the daily dose is the standard dose, but
Yeah.
it kind of encourages them um, to start using the medication.
Yeah. Yeah. I mean, and they have to understand the half-life is pretty long too, right? Um, we got a question here.
In the tissue, it is long. In the blood, it's short. But yeah, I mean that's the whole logic behind cutting the
Yeah.
dose.
Yeah. So a question here says, if I use minoxidil spray now, does that affect any future hair transplantation surgery? I mean,
No,
yeah.
no, we actually stop it a few weeks before because of the blood vessel dilation effect. It can make the procedure, bloodier, basically. So we stop it a few weeks before, and we recommence it a few weeks after, because it can irritate the scalp. But apart from that, no, there's no effect, and we actually prefer to have it as a maintenance regimen as well.
And when do you usually tell your patients to get back on finasteride? I mean, minoxidil
Uh,
after the
Not less
surgery?
than 3 weeks, to be honest, maybe
No,
1 month even.
1 month.
Yeah,
Okay.
yeah. I'll stop it 2 weeks before and recommence it 1 month after. Again, some people would recommence it before and there would be no issues, but just to be on the safe side in terms of scalp irritation and protecting the scalp itself.
Yeah. I got someone asked me a question if I had a hair transplant and if I'm on finasteride. I've had 3 hair transplant and no, I'm not on finasteride. But that's because I was pretty much in Norwood 6 when I had my surgery. I did
Hmm.
have a question though, because I spoke to 2 different doctors. I spoke to Dr. Conier and Dr. Bazanga of Belgium, and they've all said that they've been seeing great results prescribing patients oral minoxidil.
Hmm.
Now, this seems to be sort of like a new thing that's catching on. Do you have any experience with prescribing your patients oral minoxidil?
We don't have oral minoxidil available here.
Mm.
I wish we do, because I've had some experience with it abroad. And I do think that it actually is an effective medication. Studies have been showing that it's less effective than topical for hair loss, but again, maybe that's not, it may need further investigation. But I think that as far as a 0.625 milligram dose is enough, so a quarter of a 2.5 milligram tablet should be effective, and with less side effects. And I think even half a tablet or a 2.5 milligram tablet, if the side effects are not existent, then might work very well. And I've seen mostly my experience with it has been more in females
Yeah.
and also in post-chemo patients.
Mhm.
So I think it does work, I think, in my opinion. Unfortunately, we can't source it here regularly, but hopefully it will be.
Yeah, I'm running into that issue now. I have a prescription. I just haven't been able to find a pharmacy
Yeah,
that can
yeah,
really prescribe it to me. So it's been a battle. We
yeah,
got a question here from Alabad 25. He asks, can we use minoxidil after Dermaroller on the scalp?
yeah,
And that's actually pretty. That's another thing that's come out in recent years is as a micro needling, derma rolling, and then applying the minoxidil right after. I did have some concerns that were shared by me by a few surgeons, and they said basically that derma rolling, if done too aggressively, can be sort of like creating recipient sites, and that could
yeah.
cause shock loss because you can be causing trauma to the surrounding hair follicles, and it can cause you to shed instead of actually regrow hair, which is what you want to do. What are your thoughts on that?
I mean, in theory, it has a sort of a stimulatory effect in terms of collagen and growth factor migration, and this is the main effect that needling or even recipient sites, or sometimes in some cases we see it with SMP,
Mm.
needling, even without ink, that you might stimulate such, dormant follicles or telogen follicles, hairs. Um, yes, it can cause shock loss. And I think the main thing is that people are becoming more aggressive with it. So it's no longer very superficial needling.
Mhm.
People are buying the derma rollers, and even I have patients buying derma pens, which are clinic-based,
Oh wow,
pens.
yeah, I've heard of those
Uh,
dermatomes.
yeah, so they're buying derma pens, and obviously, adjusting the needle size, it becomes more of an actual recipient site. So yes, I can see the concern with it being more commercial. Um, I mean, it's hard to judge whether what's causing the effect. Some patients, again, and this might be evidence based on what patients come back with, and they say they've improved on Dermaroller and minoxidil. It's hard to tell because maybe the routine of using the Dermaroller is what's making them use the minoxidil, and that
Is
becomes more and so it's hard to justify or explain exactly the evidence behind it.
mm,
In science, scientifically, it makes sense. So if I always tell them, if whatever gets you into a system, use it,
yeah.
because we know that if you're compliant, you'll be better off in terms of your hair loss. You'll have more of your hair maintained. So if it's a routine of derma rolling, to use minoxidil after is what's gonna get you motivated to use it, then I wouldn't object to it.
Yeah, no, I agree. I haven't tried it personally, but I did in the past. But yeah, I think that's great advice. If it's getting you to apply the minoxidil every day, then definitely do it. We have a question here from Amar Deco. He says, I can't travel now to Jordan because I'm from Iraq and there's quarantine issues. How can I select the surgeon? And I know we spoke about this recently, but if you can touch on that.
As far as I know, the quarantine now is, in terms of travel, is almost resolved. So there's no mandatory quarantine, basically. So you do PCR testing in your country and upon arrival. And I think only red zones or certain countries you're required to stay in home for like 3 days, 3 to 7 days maybe. But in most countries are now actually only tested upon arrival. And if it's negative, there's no mandatory home quarantine.
Okay. And Amar, just in case you're wondering, you could go to vertexhair.com, right, to consult with you and to
Yes, we do have an online consultation. It's been up since last March. Yes, he can book an appointment. We can do it online.
Okay, great. Yeah. So, and I had another question in regards to FUE scarring, because we did talk about, donor depletions and, the problem going on with hair transplants now is there's all these clinics that are popping up that are pretty much fly-by-night technicians. There's no real surgeon that's overseeing it. It's just purely technician based and purely numbers based. They just want to get maximum amount of patients to turn profit. And so these patients have their donors, severely depleted, and sometimes it looks balder here than it does on top. What are your suggestions for, fixing these donors? Do you suggest, doing beard hair to the scalp? Do you suggest SMP? Do you think there's a way to extract around it to kind of make it look a little bit more even? What are your guys' approach?
So if someone is fortunate enough to have another procedure with a depleted donor, we try to redistribute the extraction. So in many cases, we do see one that is more severely depleted than another area, or maybe the start of the procedure was more ambitious, and then on the other side, it became more and more, evenly distributed.
Yeah.
So if that's the case, and he's having another procedure, we can attempt to redistribute. And in other cases, to be honest, I always go for SMP. That would be my, if someone really feels they want to have a shorter cut and they want to have a more even appearance in the donor, I would suggest SMP for that. And we've done it on quite a few number of people. In terms of not much of the scarring itself, but we've attempted injecting as well in it. So we've attempted injecting PRP into the donor. I tend to believe finasteride also has a role in the donor here. So if someone, for example, and I'm encouraged to do this now more frequently because I see a lot of depleted donors who would require another surgery. So what I'm doing at the moment is that we're putting them on 6 months of finasteride if they're not on it already, and then we reassess them. And we've had good improvements in some candidates that they were no candidates for surgery, and now they are, a limited candidate, or you can get a limited number from them. So I did see an improvement in the donor on finasteride in some of these cases.
Yeah, I've heard that as well. And I heard that the oral minoxidil also does that from
Yes.
a physician. So Wavy Sneaker says, doesn't SMP fade in terms of color? I heard it turns blue in some instances.
Yes. It does. It all depends. Ink in SMP is a very huge topic, and partly ink is what you know, the way you handle the ink, the depth of the ink, where it's injected, the type of the ink, and also um, post care, or you know, after the care, you know, sunlight, the type of climate you're in, exposure to sun, mainly. All of these things can cause variations in the color. So it's very important. I always stress, especially in our region and yours, sunblock. So it's very important on shaved heads to have, or you know, a
Oh,
full
yeah.
shaved SMP, to use a good sunscreen, because that would help or reduce the chance of color changing. The best thing would be is just a gradual gray fade, and that would be, you know, a home run.
Yeah. I wanted to answer one question. Somebody said, how do you maintain a natural hairline look? Your hairline results always look great. Um, Choose the right surgeon. Choosing the right surgeon, well, they'll give you a hairline that looks natural, and then you know you really don't have to do anything. You could put some wax in it or something, and it would work great. There's an interesting question here. It says, why do some people's hair not look as long in the fringe area post surgery? I'm not sure what they mean by hair not look as long in the fringe area. Like how they style it, I guess we'll have to go back to that. Maybe they can um, kind of re-ask
Maybe
that
they can,
question.
yeah.
And Alabat says, can we inject progesterone in the scalp? This is a pretty good question because we know progesterone sometimes is given to women for female hair loss. But I don't know if we can do that for men, if it'll affect them, you know, affect their endocrine system.
I would think so. I haven't tried it. I haven't heard of anyone particularly doing it. But it's an interesting question. Um, but I don't think it's advisable. I think it would cause imbalances in the male
Yeah,
scalp.
yeah. And the female, it's different.
Yes, absolutely.
Um, so we have another question here. It says, is it not better to use beard hair rather than SMP? So I think he's referring to, you know, depleted donors, you know, better to transplant beard hair.
It depends. I mean, if it's a limited area, you can technically apply it, but I find SMP as a stronger weapon in terms of, you know, the diversity with which you can work with it. So you can actually fill in literally every single
Area.
area of scarring, and it tends to give more. Whereas, you know, beard hair, if it's a big area, you need to be each scar would require few hairs actually. I mean, we've attempted that, and it's not like you're filling each dot with a scar with a hair.
Mm,
Often to give that look of coverage, you would need few hairs in each FUE extraction site, and that could take a lot of, you know, valuable hair.
mm.
Um, and I think SMP, at least attempt SMP first, because you can always transplant over that.
Yeah. And I had a question in regards to beard hair. You guys do a couple of beard hair transplants. Is the growth time different than scalp hair? Since we know the beard hair life cycle is different than the scalp hair, does it take longer to grow? Does it grow in quicker? What's your guys' experience with that?
I find that it grows quicker, or maybe let me rephrase it. I find that the results appear quicker,
Mm,
and partly because of possibly the actual growth, but also if you think about it, the layering of the beard, the direction in which it's transplanted, it gives a quicker visual effect when even you know, percentage of the result appears. So even at 6 months, it looks very good in most cases, because they all layer on top of each other. It builds density. Naturally, beards look good even when they're not dense. So the maturity of the hair itself in the beard is not a big factor, such as when you transplant the scalp. So even when the hairs start to grow, they're angled on top of each other. They grow downwards, you know, in most cases, and they just build up, and that gives a quicker visual, you know, result, let's say.
Yeah.
But yeah, it's an interesting question. I always see that, you know, people tend to reach their satisfaction point quicker.
Looks like Shasha said, I guess I mean the hairline is slightly higher post-surgery. I'm someone who had very long hair, but one's texture and donor area is different to hair that one loses. So I guess I mean the hairline is slightly higher post-surgery. I mean, the hairline placement just depends on what you agree with the surgeon, right? As you can either have your hairline placed higher, lower, depending on how much grafts you have. I think that's what she's asking. We have another question. Lately, I lost one of my eyebrows. I still don't know what's the reason. That's
probably
pretty
needs,
interesting.
yeah, I mean,
I
it
lost
needs,
one of my eyebrows. So you know, some people have like thinning in the eyebrows.
it depends. I mean, it could be a seasonal. Sometimes people get a seasonal loss. And in some cases, it could be something more dermatological in terms of types of alopecias. It definitely needs some investigation.
Yeah. Wavy Sneakers has another question. Says, weird question, but if someone is losing hair, let's say they're Nova 2, then can the doctor take out hair in the front from a Nova 3 area loss and then implant from donor? Implant area from the donor. Reason for this is so the patient would be good in the front area. So I think they're saying that if they can transplant from a place that normally could be lost, like let's say the crown or something, and transplant it there, because they're not going to have to worry about future hair loss. I think that's what he's asking. But there's no crystal ball to say that they're not going to bald in that area.
Yes, I mean, it can technically be done when you definitely see that there's no loss there or in the future. But again, to have extraction sites in the top of the head is a bit of a risk in terms of appearance, because again, you know, it would be extracting so many hairs. The direction is different. Nothing that is routinely done, definitely. So it's something that you have to look into. Maybe if someone is definitely not losing anything in that spot in the future, but not in someone in their 20s or 30s or, you know, even 40s.
Yeah. That would be crazy. What is the minimum age you would consider to treat men and women for hair transplant?
Again, it depends. Let me just check actually if I could transfer the speaker.
Okay.
Can you hear me?
Yes.
Yeah. So for men, if there's still not a full, complete Norwood 6 pattern, we rarely transplant under 24 or 25, just to make sure that the pattern we're getting is a bit more clear. For females, it depends. I mean, if someone is looking for a hairline lowering and it's nothing genetic, and there's no history of androgenetic alopecia, then that can be done at a younger age. So again, it depends on the patients. For men, it's more strict in terms of age group. We try to delay as much as we can, unless there's a very clear pattern.
All right. Yeah. So one last question before we go, guys. Alabat asked, can the chest area be a donor area? So can you extract from the chest to put it on top of the scalp? Yes.
Yes, you can. It's not the most favorable area, because hair cycles in the chest are completely different. It's only months, so you won't get long growth, but it can be done, and it's being done frequently.
All right. I think that is all for today, guys. Thank you for joining us. Again, I'm with Dr. Talib Barghouthi at Vertex Hair on Instagram. Reach him at vertexhair.com for any questions or consultations. And he's also one of our recommended surgeons, so you can go on the link in our bio and actually consult with him directly through the link. So thank you, guys. Thank you, Dr. Barghouthi, for
Thank you,
giving me
Melvin.
the opportunity and educating the community. All right, talk to you soon.
Thank you very much.
All right.
Thanks. Have a good one.
You too.
Thanks.
Bye-bye.